You could finish a 10K, feel perfectly fine, and still be carrying a blockage inside your heart big enough to kill you. No pain, no warning, nothing.
How is that possible? Because your body doesn't care how many miles you can run. It's built to hide danger, right up until the moment your heart stops. For roughly half of all men, and well over half of women, the first sign of heart disease isn't chest pain. It's sudden death. To understand why, picture the heart as an engine that never stops running. It's fed by a network of vessels wrapped around it called the coronary arteries, named for their crown-like shape. Think of them like roots feeding a tree. Cut a small root, one branch withers. The artery cardiologists nickname the widowmaker, and the whole tree comes down.
That vessel feeds the front wall of the heart's main pumping chamber. Block it, and the heart can lose its ability to pump blood to the entire body almost instantly.
It starts with the artery's inner lining, normally smooth and frictless. Over years, high blood pressure, high blood sugar, and smoking wear it down. The body responds like it would to any injury. Cholesterol arrives to patch the damage. And over decades, this hardens into plaque, a mix of fat, calcium, and cellular debris. Most people assume a blockage is like a pipe slowly closing, and that they'd feel it happening as it narrows. That seems logical. It's also wrong.
Arteries are adaptive. As plaque builds, the artery wall actually stretches outward to make room for it, a process called positive remodeling. So the opening for blood flow stays wide open. That means you can carry a serious amount of plaque and still have completely normal blood flow, zero symptoms. You can run, train, feel great, because the blood is still getting through.
So what flips the switch? It comes down to stability. Picture the plaque like a blister, a thin cap covering soft, inflamed material underneath, waiting to give way.
A sudden spike in blood pressure or intense physical exertion can tear that cap. This is a plaque rupture. The contents spill into the bloodstream, and the body panics.
It reacts like it would to any wound, rushing platelets to the site to form a clot. That's exactly right for a cut on your finger, and exactly wrong inside a coronary artery.
Within minutes, that clot can grow large enough to seal the artery completely, like a cork jammed into a bottle. This is called a type 1 heart attack.
Mid-race, he doesn't feel crushing chest pain, just off, lightheaded, nauseous, drained. He assumes it's dehydration. At the hospital, his blood work shows elevated troponin.
Troponin is a protein that leaks out when heart muscle cells are damaged. Much like the glow inside a glow stick only appears once its casing cracks.
There's a second, lesser-known scenario that often catches endurance athletes off guard: the type 2 heart attack. Imagine a disciplined 50-year-old runner with normal cholesterol.
He's having a heart attack with blood still flowing. Why? Supply and demand. At rest, even a 50% blockage barely matters. The heart doesn't need much.
But push the heart rate to 170 beats per minute, and demand skyrockets. A partially blocked artery can't deliver enough, and the heart muscle starts to starve of oxygen, a state called ischemia.
Add an irregular rhythm, like atrial fibrillation, and you get a perfect storm. A heart beating too fast to fill properly, paired with arteries that can't keep up.
Generally, chest pain doesn't show up 70% blocked. Below that, compensates silently. Above it, you might feel tightness climbing stairs, stable angina.
But here's the unsettling part. Most heart attacks happen in arteries that were less than 50% blocked, because it's the soft, unstable plaques that rupture, not necessarily the biggest ones.
There is good news. Your heart can build its own backup routes, called collateral circulation, small side vessels that reroute blood around a slow-growing blockage over time.
This is part of why a 70-year-old sometimes survives a blockage that would be fatal for a 40-year-old. The older heart simply had time to build detours.
Around 20 minutes into a full blockage. By 90 minutes, affected tissue can turn to scar, and scar tissue doesn't pump.
For men, it's often chest pressure and arm pain. For women, it's extreme fatigue, shortness of breath, even symptoms that feel like acid reflux.
When a blockage needs fixing, cardiologists thread a thin tube through the wrist, locate it with dye, inflate a balloon, then leave behind a stent, a metal mesh scaffold that holds the artery open.
But the real goal is catching problems before they become emergencies. A coronary calcium scan, a CT coronary angiogram, reveals the soft, unstable plaque that hasn't hardened yet.
A heart attack in someone who feels healthy is almost always a story of things left, not bad luck. Manage your blood pressure, manage your blood sugar, and don't guess whether your heart is healthy. Go find out.
If this helped, subscribe, follow, like, and share. I break down topics like this weekly. Know someone who thinks they're too healthy for heart disease? Share this. It could save their life.